Postural orthostatic tachycardia syndrome (PoTS) is a condition characterized by an excessive increase in heart rate when a person transitions from lying down to standing up. It is a form of dysautonomia, the disorder of the autonomic nervous system that regulates involuntary bodily functions. PoTS can significantly impact daily life and may require comprehensive management to alleviate symptoms. Causes. The exact cause of PoTS can vary, but it often involves abnormalities in blood flow and autonomic regulation. Potential causes and contributing factors include neuropathic factors, damage to small nerve fibers that control blood vessel constriction and heart rate, often seen in some autoimmune conditions. Hyperadrenergic PoTS, increased levels of norepinephrine in the blood when standing, which can lead to heightened heart rate and blood pressure changes. Decreased blood volume, lower than normal blood volume can contribute to the symptoms of PoTS, leading to inadequate blood flow to the brain when standing. Autoimmune conditions, conditions such as Sjogren's syndrome, lupus, or other autoimmune disorders can increase the risk of developing PoTS. Infections, some individuals develop PoTS following a viral or bacterial infection, which may trigger symptoms or exacerbate pre-existing conditions. Genetic factors. There may be a genetic predisposition to developing PoTS, as it sometimes runs in families. Symptoms of PoTS can vary widely among individuals but typically include tachycardia, an increase in heart rate of more than 30 beats per minute or exceeding 120 beats per minute within 10 minutes of standing. Dizziness or lightheadedness, often occurs when standing or after prolonged periods of sitting or standing. Palpitations, an awareness of the heart beating rapidly or irregularly. Fatigue, chronic fatigue that can be debilitating. Nausea, gastrointestinal disturbances, including feelings of nausea. Sweating abnormalities, either excessive sweating or reduced sweating can occur. Shakiness or tremors, especially in the legs or hands. Temperature regulation issues, difficulty regulating body temperature, leading to feelings of overheating or coldness. Cognitive difficulties, often referred to as brain fog. This may include problems with concentration, memory, and overall cognitive function. Diagnosis. Diagnosing PoTS typically involves medical history and symptoms review. Healthcare provider will assess symptoms and their impact on daily life, along with any relevant medical history. Physical examination. A thorough physical examination may be performed to assess overall health. Tilt table test. This test measures heart rate and blood pressure changes in response to changes in body position lying down to standing. It helps determine the autonomic response of the body. Active stand test. This involves measuring heart rate and blood pressure before standing and at intervals after standing to assess for tachycardia. Exclusion of other conditions. Blood tests and imaging may be performed to rule out other causes of symptoms, such as anemia, thyroid disorders, or cardiovascular issues. Treatment. Managing PoTS often requires a multifaceted approach that may include lifestyle changes, increased fluid and salt intake. Drinking plenty of fluids and increasing salt consumption under medical guidance can help expand blood volume and improve symptoms. Physical activity. Regular, tailored exercise can enhance cardiovascular fitness and improve autonomic regulation. Gradual position changes. Slowly transitioning from lying to sitting to standing can help minimize symptoms. Medications. Fludrocortisone, the medication that helps increase blood volume. Beta blockers. These can help manage tachycardia and improve heart rate control. Midodrine, the medication that helps constrict blood vessels and increase blood pressure. Ivabradine. This medication may help reduce heart rate without affecting blood pressure. Physical therapy. Specialized physical therapy programs may help improve muscle tone and blood flow. Cognitive behavioral therapies (CBT) addressing anxiety and stress related to symptoms through therapy may be beneficial for some individuals. Support groups. Connecting with others who have PoTS can provide emotional support and practical tips for managing the condition. Prognosis. The prognosis for individuals with PoTS varies widely. Many people experience significant improvements with treatment and lifestyle adjustments, while others may have persistent symptoms that require ongoing management. Fluctuating symptoms. Symptoms can fluctuate in severity, and some individuals may experience periods of remission. Impact on quality of life. PoTS can significantly affect daily activities, work, and overall quality of life, making effective management essential. Conclusion. Postural orthostatic tachycardia syndrome is a challenging condition that can cause significant distress and impairment. Early diagnosis and comprehensive treatment approach involving lifestyle changes, medications, and support are crucial for managing symptoms and improving quality of life. If you suspect you have PoTS or are experiencing symptoms consistent with the condition, it is essential to consult a healthcare provider for evaluation and appropriate management.